Hi, do you know what you can and what you cannot delegate to a certified nursing assistant or unlicensed assistive personnel? Well, NCLEX cares if you don't, because delegation is all about safety. This is NCLEX Prep 2.0. Like and subscribe to support this channel. Rule number one, you will only delegate a task to a CNA if that patient is a stable patient. Underline the word stable. If they are unstable, you will do that CNA task for your patient, or at the very least, you must be there when the task is being done. CNAs can perform routine tasks including activities of daily living such as ambulating the patient, repositioning, feeding, etc. And when you delegate any task as a nurse, remember the five rights of delegation: the right task, circumstance, person with the right direction, and supervision. So, what can't you delegate to a CNA? If the patient is unstable, do not delegate a task to the CNA, even if it's obtaining vitals. The examiner will give you details or assessment data hinting that this patient is unstable. They have shortness of breath, are in distress or some sort of crisis. They're hypotensive, actively bleeding, so this is an unstable patient. Do not delegate tasks for such a patient. Do not delegate a first-time patient to a CNA. What do I mean by first-time patient? The question will tell you that this patient is ambulating for the first time, eating for the first time after having a stroke, first time viral post-op. If you see the word for the first time, as the nurse, do not delegate that task to anyone. Do not put your license on the line. CNS do not give medications, including applying topical ointments. NCLEX will trick you by saying, help the RN apply an ointment. Guys, it's a no-no. A topical ointment is a medication and is not within CNA scope of practice to administer medications. CNS do not do any bedside invasive procedures, including giving enemas, Foley insertion, and they do not perform wound care. As a rule of thumb, if the task is within the scope of practice of a CNA, if the question hints that the CNA has not been trained or is not confident enough to do that task, do not delegate to that CNA. And when you delegate any task as a nurse, remember the five rights of delegation: the right task, circumstance, right person with the right direction and supervision. Thank you for watching. Like and share and subscribe to help grow this channel. Bye for now and see you on the next one.